As our viewers know, on my social, I tend to track case trends very deeply. I look at outcomes more than case trends, but you're there. You and your good people are doing all of God's work and the hard work, and we appreciate it. What are you seeing in your hospitals right now?
Well, frankly, right now we're on the backside of the surge. This is actually the second biggest surge we had.
Good.
Last July was a much larger. We had about 490 patients at that point in time. We've maxed out at 450. Right now we're running around 260 patients, or 40% down from what we saw a couple of weeks back. So the numbers are actually starting to come down some. So we're pretty happy about that.
That is fantastic news to hear, and kind of mirrors what we saw in Israel and UK, where the I don't want to call it the Delta variant because it's the only variant now. Basically, in America, it's 100% of cases where
Correct.
it tends to burn hot, but thank you, burn hot, but burn very quickly. Has anything changed from a month ago? Why do you think we are seeing, thankfully, by the way, a drop in cases?
Well, I think in the case of Miami-Dade County, we had a much higher vaccination rate than we did anywhere else in the state. We have over 82% of the people over 12 years of age that are vaccinated. And still, and it's a very large county. That means 400,000 people were still not vaccinated. So when you start looking at those kind of numbers, we had a huge amount of people, especially with the Delta variant and the high infection rate of the Delta variant, that really made it a really tough. But I think we're starting to exhaust that number. If you start looking at the 82% plus probably whatever percentage additionally were infected through the virus, we're probably in the 85 to 90 percentile, which is getting close to that proverbial herd immunity that we all talk about. Of course, it's a theory, but we think we're starting to get there.
You really do believe that. This is fantastic news. If so, there's probably still some pain to come in the meantime, Carlos. But it's good to hear you say that. And let's talk about the kids as well, because we got a lot of kids in New York City going back to school. Many have not been in a physical schoolroom for maybe 18 months as well. Some went back, some did not. We famously, the media likes to, Florida tends to be in focus, let's how we say. And we saw a big jump in pediatric cases. Thankfully, the outcomes for almost all those kids was positive. What are you seeing with the kids, as you guys are the #1 ranked pediatric specialty hospital in the United States?
So we really have been seeing a higher number between us and the other children's hospital here in town. We've been seeing, of all the children that we've been testing, around 15 to 17% have had the COVID positive. The only good news is that if you look at the number of kids hospitalized, the number has, although increased from what they used to be, has not been that higher number at this point in time. Now that we've had school open up for about 2 to 3 weeks, we're hoping that we've seen the highest rates, but we really don't know that at this point when it comes to children. We will know that more in the next 1 to 2 weeks, and we're hoping we're past that. When I keep saying that the surge is down, the concern that we all have is what other variants are out there in the world. And there are some other variants. The Mu variant is out there, and we don't know what that may look like. We may see some surges in the future. We don't think they're going to be as strong as these last 2 surges that we had last July and this July, but we think we'll probably potentially see a couple of more surges before this whole pandemic is over.
Yeah, and vaccinations, and hopefully also acquired and natural immunity, or a combo of the two, by the way, are doing their thing. They're doing what we were told that they would do. We're doing what history has said they have done throughout the other mini pandemics over the last few hundred years, Carlos. When we talk about, listen, it's tough to talk about any children getting sick. We all have kids. We love kids. We don't want anybody to get ill. When we talk about these cases, because the case numbers get all the attention in my industry, how many of these are asymptomatic, where you're testing to put your kid in school, the test comes back positive, and you're thinking, well, I had no symptoms. What are you seeing with regards to that?
Well, unfortunately, we have not seen that many asymptomatic, only because the people we're testing are people that have some kind of symptoms, and that's the reason why that 15 to 17%. We have not just been doing testing.
Because they've come in to you.
Yes, exactly. So what we've been seeing are predominantly kids that already have some symptoms, and from that number, 15 to 17% have COVID.
You referenced that 82% vaccination rate, Carlos, and I've talked to people, friends of mine, and people, that are not vaccinated. And the majority of the ones that aren't, that I ask them why not, they say, well, they got really sick from COVID. They're either afraid to get the vaccine because they don't want to get sick again, or they feel like natural immunity is enough. we can all debate and yell about whatever because it's a hot political topic as well. How do you ever get to 100%? Because when you have 18% unvaccinated and you think, what's the primary reason for that? There are 1.5 million unvaccinated adults in New York City alone right now as we restart our school year up here.
Same thing with Miami-Dade County. We're at 400,000 people. That's still a huge amount of people. And to your point, it's a very good point. We've seen over and over again that people who had COVID have a higher chance of getting COVID than people with breakthroughs from vaccination. And that's just that we have seen that in our cases over and over again. From a percentage basis, we see a lot more patients coming in getting COVID again from having it previously than those that had vaccination.